Hello to all. I am Vishnu. I had finished my PharmD. I am a registered pharmacist. I worked as an assistant professor in the Department of Pharmacy Practice. I dealt with the subjects pathophysiology, therapeutics first part, therapeutics 3, clinical research, and clinical toxicology. Now I am working as an executive clinical pharmacist in the Department of Antimicrobial Stewardship. So I ensure that rational use of antimicrobials are followed. In this presentation, I am going to talk about hypothyroidism. So this is actually a long presentation. A lot of things we will discuss here. So this will be divided into two parts. So part one, I will be explaining today. This presentation is worthwhile for anybody who are working in hospitals, who are clinicians, who are clinical pharmacists. If you are in a teaching profession, then this presentation might be of worth to you. If you are any person who wants to enhance their practical knowledge, this presentation can be worthwhile for you. And definitely, if you are preparing for competitive exams, this presentation might be worthwhile. So, as I said, this will be part one. So, let's begin. So, first, we'll talk about the physiology of thyroid hormone. So, there are actually two thyroid hormones. We have T4 and T3. T4 is also known as thyroxine, and T3 is known as triiodothyronine. So these hormones are usually formed on a glycoprotein which is known as thyroglobulin. So thyroglobulin is actually a glycoprotein which is present inside thyroid cell. So how do thyroid hormones get formed? So when an inorganic iodide enters the thyroid cell, it undergoes oxidation via a process known as thyroid peroxidase. So thyroid peroxidase is an enzyme which oxidizes inorganic iodide, and then it binds to tyrosine residues of the thyroglobulin. So first what happens? Inorganic iodide enters into the thyroid cell. Then it undergoes oxidation through an enzyme known as thyroid peroxidase, and then it binds to tyrosine residues of thyroglobulin. Now, this tyrosine residues are of two types. Number one, monoiodotyrosine, and number two, diiodotyrosine. Monoiodotyrosine, the short form is MIT, and diiodotyrosine, the short form is DIT. When tyrosine residues combine together, iodothyronins are formed. So as I said, we have two types of thyroid hormones. One is T4, which is known as tetraiodothyronin or thyroxine. And then we have T3, which is known as triiodothyronin. So if tyrosine residues combine together, iodothyronins are formed. So you can see two equations there, DIT and DIT. So diiodotyrosine, if two molecules of diiodotyrosine combine together, it is called T4. And if a MIT combines with a DIT, it is called T3. Then this thyroid cells, they undergo proteolysis, and that releases thyroid hormone into the blood. And then the thyroid hormone will start showing its activity in our body based on its functionality. So this is the physiology of thyroid hormone. In very simple terms, I just explained. So if we talk about hypothyroidism, it is a condition in which thyroid hormone level is below normal due to inadequate secretion of thyroid hormone from thyroid gland. So if there is a low level of thyroid hormone in your body, that is called hypothyroidism. And hypothyroidism is usually very commonly seen. Let's talk about the etiology. So we have two types of hypothyroidisms. One is called primary and the other is called secondary. Now, even if you don't consider this classification also, you can simply read the reasons by your own also without, specifically classifying. So the first reason is autoimmune thyroiditis. Always remain. What do you always remember? What do you mean by autoimmune? Autoimmune means automatic immunity. So wherever you hear the term autoimmune, always remember your body's immune system considers your own body as enemy. So autoimmunity means your body's immune system considers your own body as enemy and starts sending antibodies towards it. So if you read any autoimmune disease, for example, psoriasis, rheumatoid arthritis, systemic lupus erythematosus, and now we have come to another autoimmune disease known as thyroiditis. To some extent, type 1 diabetes also happens due to autoimmunity. Please remember, type 1 diabetes to some extent is also due to autoimmunity, because there also it has been seen that there is autoimmune destruction. Means the body's own immune system is destroying the beta cells of the isolate of Langerhans of the pancreas. So autoimmune thyroiditis is also known as Hashimoto disease. So if you are suffering from Hashimoto disease, you will definitely have hypothyroidism. Iatrogenic causes. Iatrogenic causes are usually also known as medical reasons. For example, a particular surgery was performed and there was some kind of mistake in the surgery. So because of that, the thyroid gland got damaged. So the patient is having hypothyroidism. Or if the patient is undergoing radiation chemotherapy. Radiation therapy, usually we give it for cancers. In that condition also, if the patient got the thyroid gland damaged, then it can lead to hypothyroidism. So it is also known as iatrogenic causes. Silent thyroiditis. Silent thyroiditis means it does not involve autoimmune pathophysiology or etiology. It can be thyroiditis or inflammation of the thyroid gland due to some other reason. Thyroiditis means inflammation of the thyroid gland. So it also includes postpartum. Postpartum means after delivery. That is why there is a condition known as PPD, postpartum depression. So this is very, very commonly seen in females. In most of the females after delivery, they suffer from a certain kind of depression. And if that depression is not properly controlled, then they go to the extent of disowning the baby also. Means they will not have feelings towards the baby also. So this can happen if the female is already suffering from hypothyroidism. Then after delivery, the neuropsychiatric changes can become worse. Anyways, when I'll talk about antidepressants, there is a molecule known as brexanolone, which is actually approved for the treatment of postpartum depression. So when I talk about antidepressants, then I'll come to that. And definitely in iodine deficiency also, you will have hypothyroidism. You know the reason very well, because when I talked about the physiology of thyroid hormone formation, I had said that inorganic iodide enters into the thyroid cell and then it shows its action. So if your body is deficient in iodine, then you can have hypothyroidism. There are certain drugs that can cause. Actually, the list is very huge, but still, I just mentioned some of them. The most famous example is amiodarone. Amiodarone is an antiarrhythmic and it has a very special characteristic. Amiodarone can cause both hypothyroidism and hyperthyroidism. Now, this is very, very interesting. Amiodarone causes both hypothyroidism and hyperthyroidism. Now, the question comes, how does it happen? If you are living in an area where there is normal thyroid condition, for example, if you are living in an environmental area condition where the thyroid level is normal, there amiodarone will reduce the level of thyroid hormones, which can cause hypothyroidism. But if you are living in an area where thyroid hormones or iodine deficiency is seen, so amiodarone is actually a molecule which contains iodine in it. In its chemical structure, there is iodine. So if you are living in a particular area where there is iodine deficiency, amiodarone, the iodine which is inside amiodarone, will go into the body and trigger the formation of thyroid hormones. So in that condition, it can cause hyperthyroidism. But normally we live in a geographical area where thyroid conditions are normal. I mean, iodine levels are normal. So that is why hypothyroidism is more commonly seen than hyperthyroidism. Once again, if you are living in a environmental area where there is normal thyroid conditions, the iodine which is present inside amiodarone will prevent the formation of thyroid hormones, which can lead to hypothyroidism. But if you are living in a geographical area where there is iodine deficiency, the iodine inside amiodarone will increase the formation of thyroid hormones, which causes hyperthyroidism. But since we live in a geographical area normally where there is euthyroid conditions, that is normal thyroid conditions, hypothyroidism is more commonly seen than hyperthyroidism. Then there are some radio contrast media. So these are usually used for diagnostic purposes in hospitals. That can also, they actually cause nephrotoxicity also, but they can cause thyroid problems also, which can lead to hypothyroidism. And lithium, this is very, very interesting. Lithium is uh, a molecule which usually causes hypothyroidism. Actually, lithium is used for mania because, and there is a very special feature of lithium. See, whenever we talk about depression, there is actually a factor known as BDNF, brain derived neurotrophic factor. And this BDNF is important for the functioning of serotonin and norepinephrine, and they are good for depression. If the level of BDNF in your brain is low, then serotonin and norepinephrine will also reduce. That can lead to depression. Lithium actually increases the level of BDNF. So that is why in the long-term usage, it is actually good for depression. But we directly don't use it as an antidepressant because this is a very dangerous medicine and it requires therapeutic drug monitoring. So we don't go for that. We usually go for conventional antidepressants. Now we come to, if you are having any kind of damage in the pituitary gland or in the hypothalamus, then you may suffer from hypothyroidism. Now let's come to the pathophysiology of hypothyroidism. So there is a condition known as subclinical hypothyroidism. Always whenever I teach people or whenever I learn by myself, I always try to correlate things. Why I try to correlate things is because it's very easy to say that we have graduated from any division of pharmacy or we are medical professionals. But the biggest challenge that comes in our day-to-day life or professional life or learning sphere is how far do we remember things? Okay, when you are doing your clinical practice, definitely repeatedly you are seeing those things so you can remember. But what about those people who are not getting practical exposure? There are so many people who are not getting proper hospital duties. There are so many people who are going to the hospital but don't know what to do. There are so many people who are not getting proper guidance from their college as well. Mostly, many of them are having scholastic grades. That means their academic marks are very good. But when it comes to practical knowledge, they know nothing. So I always believe that the best way to study, or this is something that I want to say here, the best way to get practical knowledge is to either practically see or practically visualize. Practically see means you are going to the hospital, you are seeing repeated cases, so you are getting practical knowledge. Practically visualize means you are not getting exposure in the hospital, but you are reading some websites or books or some authentic articles through which you are creating your own visualization. So that also increases your memory. So these are two ways to enhance your practical knowledge. Anyways, I'll come with a detailed video on this. Why I talked about this point is, here in the bracket you can see I have written similar to pre-diabetes. Now the question arises, what is the connection between subclinical hypothyroidism and pre-diabetes? What is pre-diabetes? It is a condition in which you are getting a warning signal that your blood glucose level, your HbA1c, glycosylated hemoglobin, all these things are slowly rising. If you want to be careful, be careful. Otherwise, a stage will come where diabetes will happen and you will never be able to come out of it. Because you know very well that diabetes is incurable. But unfortunately, pre-diabetes is the most unfortunate diabetes. Why? Because you will never come to know that you actually had pre-diabetes. Because in pre-diabetes, the symptoms are very, very, very minute. Usually, you get the symptoms when you become diabetic. Similarly, in subclinical hypothyroidism, you don't get the symptoms of hypothyroidism. So that is why you are listening to this, you may not even know whether you are actually having hypothyroidism or not. That is the problem. So my personal advice to everyone is, if you are having a family history of hypothyroidism, if you are having a family history of diabetes, please make sure that you get a full body checkup done at least twice a year. Why am I saying this is because thyroid disorders like hypothyroidism and diabetes mellitus are those kind of diseases in which you will not directly get the symptoms first. Nobody becomes diabetic directly. First, they become pre-diabetic and then they become diabetic. But unfortunately, we only come to know when we become diabetic. So, obviously, you can't check for blood glucose level every day. So, my personal advice is, if you are having a family history of diabetes or hypothyroidism, please get a full body checkup done. Anyways, in a full body checkup, you will come to know of other parameters also, which is helpful for you. But please get it done. Because once you arrive at this disease, then coming back is almost a dream. Then you will have to live with the disease. So that is why subclinical hypothyroidism is a very unfortunate part of hypothyroidism, because you will not get the symptoms, and since you do not get the symptoms, you will always feel like everything is normal with you. So the symptoms of subclinical hypothyroidism include fatigue, cold intolerance, and constipation. So here you can, get some kind of relief. Usually the symptoms do not come, but if you are having cold intolerance, so this can be a warning sign of hypothyroidism if you are having cold intolerance. For example, you are living in a humid area, you are living in a warm climatic condition, but you are getting maybe goosebumps, or maybe your skin is becoming very rough, or maybe you are having cold like sensations, then this may be a warning sign of impending hypothyroidism. Get yourself checked. If subclinical hypothyroidism is not diagnosed and managed properly, it can lead to cardiovascular events. So this is also another thing. In hypothyroidism, there is elevated level of cholesterol. So that can also increase the risk of cardiovascular mortality. You know very well, if cholesterol level rises, what all problems can happen. In hypothyroidism, systemic vascular resistance can increase and diastolic blood pressure may also increase. So this is not a very good indication or very good news for people who are also suffering from stroke. Because what happens in stroke is, I have seen in most cases, the diastolic blood pressure also tends to rise a lot. So that is not a good sign for a patient who is suffering from stroke as well. In hypothyroidism, cardiac output reduces, and this is actually a very big risk factor for heart failure. So this almost indicates the shutdown of the function of the heart. So in the long term, especially if you are having other risk factors also like hypertension, dyslipidemia, diabetes mellitus, then, or maybe you are taking some drug which causes heart failure as a side effect, then this problem can get aggravated. In hypothyroidism, neuropsychiatric problems can also occur, including memory loss or dementia, especially in the elder. I'll come to that later. Why it happens, I'll describe it in detail. Hypothyroidism in pregnancy. Very, very dangerous. As I said before, if a mother is already having hypothyroidism and she delivers a child, then she can suffer from depression for a very long period of time. So the fetus is entirely dependent on maternal thyroid hormones during the first trimester of pregnancy, because thyroid hormones in the first trimester of pregnancy are very important for the development of the central nervous system. So if the mother is already hypothyroid, in that condition, either there will be miscarriage or there can be developmental impairment. So for example, even if the child is born, the child will not be able to perform well in school, because thyroid hormones are necessary for CNS development in the first trimester of pregnancy. If hypothyroidism in females during pregnancy are not managed properly, when the child is born, if usually miscarriage happens, but even if the child is born, the child will not be a good student, because the child will have developmental, neurodevelopmental problems. So it can be anything. It can be any kind of neurodegenerative problems, but the child may have. In severe cases of hypothyroidism, there is a condition known as myxedema coma that can happen. So in such cases, you can have CNS depression. So CNS depression definitely also means respiratory depression, because CNS depression means, you can easily understand, CNS depression means it will inhibit three parts of the brain, that is cerebrum, cerebellum, medulla oblongata. Medulla oblongata, if it is inhibiting, that means definitely it will cause respiratory depression, and it will reduce your heart rate also. Why? Because medulla oblongata is responsible for maintaining your heart rate and also your respiration. And if your heart rate tremendously reduces, then it can lead to heart failure also. It can cause fluid and electrolyte imbalances to some extent. So now we come to clinical manifestations. So the symptoms and signs. Always what we do is we get confused. Symptoms means what the patient is telling to the doctor, and signs mean what the doctor is seeing in the patient. So symptoms can be fatigue, lethargy, sleepiness, mental impairment, depression, weight gain, menstrual abnormalities, paresthesia, cold intolerance, hoarseness, dry skin, reduced perspiration, anorexia, constipation, and arthralgia. Here I want to tell you a very important thing. Here it is written paresthesia. So why will hypothyroidism cause paresthesia? Paresthesia is actually a burning sensation or tingling sensation in your arms or feet. So that usually happens because in hypothyroidism, there is fluid and electrolyte accumulation, which actually increases the pressure on the nerve endings also, on the nerves also. So that can lead to occasional paresthesias. Coming to the signs of hypothyroidism, it can reduce your body movements. Definitely, it can cause goiter, slow speech, hoarseness. Your voice will become very rough, bradycardia, dry skin, weight gain, and hyporeflexia. Hypo means less, reflexia means movement. So you can understand very well. Now, I will be explaining in future slides one by one why these symptoms or signs occur. So why will a patient suffer from fatigue in hypothyroidism? So thyroid hormones are actually, so first of all, you have to look at the function of thyroid hormones. Thyroid hormones, usually whatever food that you take inside, thyroid hormones utilize that food for producing energy. So burning food means burning the calorie that you are taking through food and provide energy. Now in hypothyroidism, this metabolism will not occur. So all the calories will stay in your body, but it will not be burnt or utilized to provide energy. So you will always feel lack of energy. In that condition, you will always be tired or fatigued. So that is why fatigue is very commonly seen in hypothyroidism. Why sleepiness in hypothyroidism? So first reason I already mentioned in the previous slide, when you are always fatigued, when you are always lethargic, then definitely you will always feel like sleep. Another problem is hypothyroidism can cause cold intolerance. So I just can't imagine what will be the condition of a person who is suffering from hypothyroidism and is living in a cold country or maybe in winter seasons. Because in normal seasons also they can have cold intolerance. So definitely if you are having cold intolerance, you will develop goosebumps, you will have shivering and all these things. So that will definitely affect your sleep. Hypothyroidism can also cause joint and muscle pain. So that can also definitely affect your sleep because pain means you will not get a proper sleep at night. So at the daytime, you will be very drowsy. Your work life will not be good. Your quality of life will be impaired. Why mood alterations in hypothyroidism? Always remember thyroid hormone and serotonin are best friends. So thyroid hormone actually is involved in the production of serotonin and also in the regulation of the activity of serotonin. And you know the function of serotonin. It is, it makes you feel good. It regulates your mood. It makes you excited. And it also regulates your thought process. In hypothyroidism, serotonin levels may get reduced. So that can lead to depression and subsequent anxiety. Why subsequent anxiety? Now, see, depression and anxiety are entirely different things. Depression means your brain is functioning very low. Anxiety means your brain is functioning too high. So, why is it that a depressed patient can suffer from anxiety also? The reason is very simple. If you are suffering from depression, there will be a cause for that depression. And when there is a cause for that depression, you will always overthink because you will always think whether the same thing will happen to you tomorrow also, whether the same thing will happen in future, then how will I deal with it? So this unnecessary thought process leads to overthinking, which is also known as anxiety. So that is why SSRIs are used in depression also, and SSRIs are also used in anxiety. This is the reason. So you can overthink or suffer from anxiety. But always remember, anxiety is mostly seen in hyperthyroidism in comparison to hypothyroidism. But still, to some extent, anxiety might be there. Why memory impairment in hypothyroidism? So, thyroid regulates the metabolism in all the organs, including the brain also. So, if proper metabolism doesn't happen in the brain, so that can cause reduction in memory span. So maybe I'll say something to you today and maybe a few hours later you will forget. So that is memory loss or dementia. It can cause short-term memory loss also. So this is not at all a very good news for those patients who are already suffering from Alzheimer's disease. Just imagine. Let's consider a scenario. This is how we study practically or visualize practically. If a patient is suffering from hypothyroidism and the same patient is also suffering from Alzheimer's disease, then the dementia will get more worse because hypothyroidism causes memory loss. Let's make another practical knowledge from this. If a patient is suffering from hypothyroidism and the patient is also taking anticholinergics, then and also if the patient is elderly, geriatrics, then the level of dementia will be super high. What is the reason? Because anticholinergics usually cause dementia or memory loss, and definitely if the patient is also hypothyroid, then the dementia will only become higher and higher. And on another problem with hypothyroidism is you will not be able to concentrate properly. So for example, you are trying to read something, you will become extremely fickle minded or you are reading something, but it is a very simple sentence, but you are taking lot of time to process what you are reading. Or suddenly if something is asked to you, you become totally blank, which is also known as brain fog. So all these things may be seen if you are suffering from hypothyroidism. Why weight gain in hypothyroidism? So there are two reasons. First reason is known as the metabolism theory. So this is very simple. Whatever food you are eating, it is digested, the energy is used by our body, and the waste materials are eliminated. But here, metabolism doesn't happen, or it becomes very slow. So when metabolism is very slow, lesser calories will be burned. And if the amount of calories is high in your body, definitely it will cause weight gain. And that is why if you are obese and you are hitting the gym, then definitely you are always advised to eat diet which is lesser in calorie. Then we have a fluid and electrolyte theory. So hypothyroidism can actually cause accumulation of salt and water. So it is a kind of edematous condition, but that also results in weight gain. So these are the two possible explanation as in why weight gain is seen in hypothyroidism. Why menstrual problems in hypothyroidism? So here two things will happen. So it is like two extremes. It is like North Pole and South Pole. Either you will have very severe periods or you will not have periods at all. It depends on how severe your hypothyroidism is. Now, why heavy periods will happen? So that is what is explained here. Hypothyroidism stops ovulation. So it is that process is known as anovulation. If ovulation is stopped, it is called anovulation. And in anovulation, what happens? The uterine lining is damaged and the growth of the uterine lining is prevented. So that can cause heavy bleeding from the uterus. And why it is written unpredictable is because you will find it very hard to predict when your periods will be or when your menstrual cycle will be. So this is one problem that can be seen with hypothyroidism. Now we are coming to exactly opposite scenario. Hypothyroidism can stop periods completely also if it is very severe. How is it possible? Hypothyroidism increases the level of prolactin. And prolactin actually again thins the uterine lining and also causes abnormal function of ovaries. So that can lead to stoppage of periods. So we have seen females who complain of not getting periods for a long period of time. And we have females who complain of heavy bleeding, heavy pain, heavy discomfort during their menstrual cycle. And that too, it is unpredictable. They can't predict it like it is happening, it is occurring in a proper cycle or not. Why cold intolerance in hypothyroidism? As I said before, you will feel extremely cold. Thyroid hormone regulates your metabolism and temperature also. So in hypothyroidism, what happens? The body temperature will drop due to damage in the hypothalamus. Cutaneous, that means the skin vasoconstriction occurs. See, usually you get goosebumps like that only. When you are feeling very cold, your skin is totally exposed to the cold climate, somewhere you get goosebumps. So that kind of feeling you can have if you are suffering from hypothyroidism. So due to the above features, as I said, the body temperature drops, the cutaneous or the skin vasoconstriction occurs. So due to the above features, the patient can feel cold even in warm environment. Why will your voice become, especially in a female, why will the voice becomes very, very hoarse or very, very rough in hypothyroidism? This is very interesting. So we have a voice box which is known as larynx. So that is actually located very close to the thyroid. When you are suffering from hypothyroidism, there is local inflammation and pressure. That means pressure in the nearby area. And nearby area is larynx. Larynx is present very nearby. So that inflammation will affect the larynx also. So the voice will become very rough and hoarse. So this is usually seen in hypothyroidism. Why dry skin in hypothyroidism? So we have a particular kind of sweat glands, which is also known as eccrine sweat glands, ECCRINE, eccrine sweat glands. So they are distributed all across the human skin. They secrete lot of sweat per day, and in that process, they maintain body temperature also. In hypothyroidism, the opposite happens. The eccrine glands are damaged. So as a result of which, sweat will not be produced. So that is why patients with hypothyroidism, they do not sweat a lot. There will be no perspiration because the eccrine glands are damaged. So the skin will become very dry because when you are producing sweat, the skin is moist. So if you are suffering from hypothyroidism, the eccrine sweat glands will be damaged. So sweat will not be produced. So no perspiration. The skin becomes very dry and you will always have itching sensation. So that is why patients with hypothyroidism also complain of itchy sensation on their body. Why anorexia in hypothyroid? Why will you not feel hungry? So there are two possible explanations. One is called CNS appetite circuit theory. So this is actually a neurological mechanism. So T3, that is triiodothyronine, directly stimulates food intake at the hypothalamus level. That means T3 hormone activates the hypothalamus, and that is what makes us feel hungry. So in hypothyroidism, T3 level will be low. So that stimulus will not occur. So it can cause anorexia. Now we come to the metabolism theory. So that I said before, thyroid hormone is responsible for maintaining your metabolism. In hypothyroidism, metabolism slows down. So calories will not be burned. So they accumulate inside your body. So when calories are already there inside your body, how will you feel hungry? So that is why you will always feel that your stomach is full. That can lead to anorexia. There is another reason also why you actually feel anorectic in hypothyroidism. That means you don't feel hungry. Because in hypothyroidism, bowel movement also becomes very slow. So bowel movement becomes slow means you get constipation. So in that condition also, you will always feel that your stomach is full. So you will not have a tendency to eat. Why constipation in hypothyroidism? So hypothyroidism slows down the metabolism. If metabolism becomes slow, then the digestive process becomes slow. If the digestive process becomes slow, then the bowel movement becomes slow. And if the bowel movement becomes slow, then you can suffer from constipation. And that is exactly the reason why you will not feel hungry due to hypothyroidism because you are having constipation. So you will always feel that your stomach is full. Why muscle pain in hypothyroidism? So these are some technical terms. There are some reasons mentioned here. Deposition of glycosaminoglycans. So if you study glycogen storage diseases, then you will come across this term. Glycosaminoglycans, if they are deposited, they are actually very dangerous in nature. These are actually polysaccharides. So they can cause muscle related problems. Poor contractility of actin myosin units. So actin and myosin are actually proteins which are responsible for muscle contraction. So if the contraction is low, you can have muscle pain if you do little work also. Because whatever work you are doing, you need contraction of muscles. So if that does not happen properly, you will experience myalgia or muscle pain. Low myosin ATPase activity, that is low muscle contraction velocity. So if the muscle contraction velocity reduces, that means muscle contraction will not happen properly. So if you are doing some kind of heavy work and your muscles are not contracting properly, definitely you will experience pain. So for example, this is very, very notorious for those people who are working as laborers or who are working as coolies in railway stations. because there you have to lift heavy load. You will always have to keep your body active. And if you are suffering from long-term hypothyroidism, muscle contraction will be less. And with that low muscle contraction, if you are doing heavy work, then definitely you will experience muscle pain. Low ATP turnover in the skeletal muscle. It is very simple term. The activity of ATP in the skeletal muscle will be less. So muscle contraction will not happen properly, which can lead to muscle pain. Why slow movements in hypothyroidism? So just in the previous slide itself, I explained hypothyroidism causes myopathy. That means damage to the muscle. So that myopathy can slow down the movements in general also. Because obviously when you are having muscle pain, you will not tend to move your muscles more, or you will not tend to move your body more. So you will be a very, very slow moving person. Why sexual problems in hypothyroidism? So there are two possible explanations. One is called prolactin theory. Thyroid hormone and prolactin are enemies. So in hypothyroidism, prolactin will increase, and this actually causes dryness of the genital area, especially vaginal area. So this can lead to painful sexual intercourse, which is also known as dyspareunia. Now we can take a practical knowledge from this. If you are a female and you have attained menopause and you are a female who is also suffering from hypothyroidism, your sexual life will be very, very limited. Why? Because the main reason of taking hormone replacement therapy, one of the main reasons of taking hormone replacement therapy after menopause is actually painful sexual intercourse also. Because estrogen lubricates the genital area. So, if you are suffering from hypothyroidism and you have attained your menopause as well, then it can cause painful sexual intercourse, which is also known as dyspareunia. This is exactly what I said. This is how you should correlate things and study. So you can remember better and you can explain to others also better. Now we come to dopamine theory. So if you are a person who knows about schizophrenia, then you will understand what I have said here. The major side effect of antipsychotics is hyperprolactinemia, because the mechanism of action of antipsychotic is to reduce the level of dopamine. And dopamine and prolactin are enemies. So when dopamine reduces, prolactin increases. Dopamine, you know very well, it is important for sexual desires. Whatever feelings you have, whether it is a feeling of happiness or feeling proud or feeling excited or having sexual feelings, romantic feelings, dopamine is necessary. Now, in hypothyroidism, as I told you, prolactin is elevated. So, when prolactin is elevated, dopamine may get reduced. So, consequently, sexual feelings may also get reduced, which can lead to sexual dysfunction. So, these are two different problems that might be seen in hypothyroidism. Why risk of cancers and cysts in hypothyroidism? So, here we come to best friends. Thyroid and estrogen are best friends. So, if a best friend is in trouble, thyroid will try to save it. So it means liver actually breaks down estrogen, which is eliminated by the body. Now, the best friend of estrogen is thyroid. In hypothyroidism, the breakdown of estrogen by the liver is slowed. So, estrogen accumulation can increase the risk of breast cancer, uterine fibroids, ovarian cysts, and ovarian cancer. Why slow speech in hypothyroidism? So that I have already said before, that the larynx, that is the voice box, it is very close to the thyroid gland. So when there is hypothyroidism, there is local inflammation which can affect the voice box. So your speech can become slow, or what you speak, people will not be able to understand, like that kind of things may be seen. If you look at the diagnosis, usually we do thyroid function test, so there will be high level of TSH and thyroid hormones level will be low. Anyways, I have not explained that in detail here because later on I'll come back with a separate video on clinical laboratory parameters where I will be talking about thyroid function test, renal function test, liver function test, etc., etc. So there I'll talk in detail. So that's it for today. Tomorrow I will be talking about goals of therapy, pharmacotherapy, and non-pharmacotherapy, which will also include patient counseling, which are the different food that you should eat, which are the different food you should not eat, and all those kind of things I'll be talking about in the next video, that is in the part 2 version. So thank you so much for listening to me. I hope I have been of service to you with regards to practical knowledge. And as I said before, please make a habit of making good notes. Please make a habit of reading authentic books which actually make you feel interested rather than reading books which are rich in information but poor in explaining properly. So, any doubts or any clarifications you need, you can comment in the comment section. I'll definitely try my level best to respond to you. And if you need a PowerPoint of this, then please contact me in LinkedIn. I'll try my best to respond you back and share you notes regarding this. Thank you so much for listening to me. Until the next time, it's